Okay. Good evening, everyone, and welcome to AFA New England's Spring Speaker Series webinar, Learn to Understand and Manage Asthma. And this is indeed a special webinar that we're hosting tonight because today is May 6th, and May 6th is World Asthma Day. It is also World Nurses Day. And so it is a special day, and we are delighted at AFA New England to be able to present this webinar for you about asthma and to raise awareness. We want to thank Amgen as the sponsor for our webinar tonight. We truly appreciate their support of our educational programming. My name is Jan Hansen, and I'm president of the Asthma and Allergy Foundation of America, New England chapter. We're known as AFA New England, and we are thrilled to have you here with us tonight. Our expert speaker tonight is Brandon Powell. Brandon is a medical science liaison with Amgen and a critical care pharmacist. And I'm going to be turning the program over to Brandon in just a moment or two. But first, for those of you who are not familiar with AFA New England, I want to share with you that we are a patient education and advocacy nonprofit organization. Our mission is to improve quality of life for everyone who has asthma and allergies, including food allergies and related diseases. We serve all 6 New England states, and we've been doing this since 1979. We fulfill our mission through a wide range of activities and programming, mostly all offered free to the community. And those activities include our awareness programming, our legislative advocacy for improved public policies, our support for research, our support services for our community, and through our educational programming, such as our speaker series webinar tonight. AFA New England is truly proud to serve our asthma and allergy community in New England. Now, tonight, our program will be recorded. It already is being recorded, which means that it will be available for future viewing on our website. So you can look for it at asthmaandallergies.org in probably 4 to 6 weeks. And it should be up at that point in time if you've missed any portion of this program or if someone wasn't able to join that had wanted to. Before we get started, I have some very brief notes that I want to share with you. We are going to ask that everyone please keep your sound on mute so that everyone has the best possible audio experience. That will be helpful for all of us. If you have a question, though, at any time during this webinar, during Brandon's presentation, please don't hesitate to write it into the chat. And I know that some of you have already submitted questions when you registered for the program, and we'll be getting to those at the end of the program. I also want to mention that any mention of an organization or an institution or its products or services shouldn't be viewed as an endorsement or a recommendation by AFA New England. And of course, information that's shared in this webinar should not be used as a substitute for seeking professional medical care if you have a question about a specific symptom or health condition. And now, for our important webinar tonight, Learn to Understand and Manage Asthma, I am delighted and pleased to turn our program over to Brandon Powell. Brandon.
Awesome. Let me get everything shared for you guys. So good evening, everyone. My name is Brandon Powell. As Jan mentioned, I'm a clinical pharmacist, and I currently work as a medical science liaison with Amgen. I'm here to talk to you about asthma. Thank you to Amgen, as well as the Asthma and Allergy Foundation of America, New England chapter, for this opportunity to talk to you guys on World Asthma Day. How truly exciting is that? Also, a big thank you for listening in and taking charge of your health and educating yourself. LUMA stands for Learn to Understand and Manage Severe Asthma. My goal today is to help you learn and understand and manage your asthma so you can have a productive conversation with your asthma healthcare provider. And most importantly, I want to empower you to advocate for yourself and your loved ones. Before we get started, let's try something. Take a deep breath in. Now exhale. Pretty easy, right? Now imagine trying to do that through a thin straw. Or picture an elephant sitting on your chest while you desperately try to get air. That's what an asthma attack can feel like. I would guess that most people have ran out of breath or had to catch their breath after running up a flight of stairs. But imagine feeling that way just from laughing too hard or walking outside on a cold day. Asthma affects over 300 million people worldwide, but many asthma emergencies are preventable. The right education, knowing your triggers, using inhalers correctly, and having an action plan can be the difference between a day in the ER or just a normal day. Before we get started, I wanted to share some important information. This program is being brought to you on behalf of Amgen and AstraZeneca, who are the sponsors. It's meant to be educational. That means I'll be sharing general information about asthma, especially severe asthma, but I won't be giving any personal medical advice. I won't be able to answer any questions about your specific condition or which treatments might work best for you. For that kind of guidance, it's always best to talk directly with your doctor or asthma specialist. Here's what I'll be covering in today's program. First, you'll learn that asthma is a long-term condition where the airways stay inflamed or swollen. Then we'll understand how your immune system might be involved in asthma, especially in more severe cases. And finally, we'll talk about how you can manage your asthma by playing an active role in your care. By the end of the session, you should feel more confident about what asthma is and how to take steps towards better control. When we say that asthma is a chronic disease, that means that it doesn't go away. It lasts a long time and often your whole life. Asthma causes inflammation in the airways, which means the inside of the breathing tubes in your lungs can get swollen, red, irritated. This makes it hard to breathe and can lead to symptoms like coughing, wheezing, or feeling tight in the chest. Learning that asthma is a long-term condition is important because that's the first step towards understanding how to take charge of your asthma and how to make you feel better and stay healthier. So if you're sitting there thinking, hey, I have asthma, or I know someone who does, you're not alone. Asthma actually is very common in the United States. Nearly 25 million people in the US have asthma. That's about 1 in every 12 people. Of those, up to 10%, or 2.5 million, have severe asthma. And the worst part is, half of those patients still don't have it under control. That means there's 1.25 million Americans who are still struggling with symptoms despite being on current therapies. So with that, let's talk about what severe asthma means. Severe asthma is a type of asthma that's hard to control. Even when someone is using strong inhalers, such as high-dose steroids and other long-acting medications, they may still have symptoms or asthma attacks. This can happen even when someone is taking their medicine exactly as prescribed and doing all of the right things to stay healthy. There are different kinds of medicines that can be used to help manage severe asthma, and some of these include short-acting rescue inhalers, which would give quick relief when symptoms flare up during an asthma attack. These could be long-acting daily controller medicines, which help prevent symptoms from happening in the first place. It could be steroid pills, such as a steroid dose pack, which would be used for more severe flare-ups. These could be medicines that treat allergies. There's also biologic medicines, which are newer treatments that work on your immune system. Even with all of these options, some people with severe asthma still have trouble keeping it under control. That's why it's important to work closely with your healthcare team to find the best plan specifically for you. Even with all the medicines we talked about, some people still struggle to keep their asthma under control. That's what we call uncontrolled asthma. It means you're still having symptoms even though you're taking your medicines, following your asthma plan, and trying to avoid your triggers. You might still need your rescue inhaler often, wake up at night, or miss work or school because of your asthma. If that's happening, it's a sign that your asthma may not be well managed, and it's important to talk to your doctor about what else could help. That brings us to one of my favorite points. This is called the rules of two. And it's a simple but very powerful tool to help you figure out whether your asthma might be out of control. So we'll pause and ask yourself these questions privately. Do you utilize your quick reliever inhaler more than 2 times a week? Do you refill that inhaler more than 2 times a year? Are you waking up at night with asthma symptoms more than 2 times a month? Have you had to take steroid pills more than 2 times a year? If you answered yes to even just one of these questions, it's a sign that your asthma may not be well controlled, even if you think you're managing it pretty well day to day. That's a conversation worth having with your healthcare provider. The sooner you talk to them, the sooner you can make adjustments and get back on track. So the rules of two is really a great tool to check in with yourself regularly. It's a quick, on-the-spot assessment that you can do before problems become even bigger. I really like this strategy and have found it to be very impactful for patients. So when in doubt, think about the rules of two. Let's take a closer look at what's really happening in the lungs with asthma. On the left, you see a healthy airway. It's open, clear, easy to breathe through. There's no swelling, extra mucus, no symptoms. You feel great. In asthma, the airways often become oversensitive to things like dust, smoke, cold air, or even stress. A trigger is anything that can make your asthma worse. It could be pollen, pets, exercise, cold weather, or even strong emotions such as laughing too hard. Everyone's triggers can be different, and part of managing asthma is learning what yours are and trying to avoid them when possible. When someone with asthma is exposed to one of their triggers, the airways can swell up, tighten, and make extra mucus. That's inflammation, and it's making it even harder to breathe. On the right side, you can see what it looks like during an asthma attack, or an exacerbation you might hear. This is when it gets even worse. The airways are even narrower, and symptoms like coughing, wheezing, and chest tightness can really kick in, making the symptoms even worse. So now that we've seen what's going on inside of the airways during asthma, let's talk about what they actually feel like. When the airways are swollen and narrow, it can cause a variety of symptoms, and they're not the same for everyone. Some common ones include coughing, especially at night or early in the morning, chest tightness, which might feel like pressure or squeezing. This is kind of going back to that elephant on your chest example. Shortness of breath, where it feels hard to get enough air, and wheezing, which is a whistling sound when you try to breathe out. Everyone's asthma is a little bit different, and some people have just one or two of these symptoms, and others may have all of them. They may happen at different times. The key is to learning to recognize your own signs and symptoms so you can take action early. To figure out if someone has asthma and how severe it is, doctors look at a few different things. They'll ask you about your medical history and symptoms, do a physical exam, and often run studies like lung function test and sometimes blood work. All of this together helps your doctor get a clearer picture so they can make the right decisions and diagnosis and build a plan that works best for you. This is why it's so important to stay regular with your doctor and asthma specialist. There's not one single standalone test to determine whether or not you have asthma. It's really a combination of all of these things put together. Now, moving to the second objective in today's program, understanding the role of the immune system in asthma. For many people, asthma isn't just about the lungs. It actually starts with the immune system. When your immune system overreacts to things like allergens or irritants, it can cause inflammation in your airways. And that's what leads to many of the symptoms we talked about earlier. In this next part, we'll look at how the immune system works in asthma and why this matters for understanding your treatment options. Our immune system is designed to protect us. It fights off things like bacteria and viruses that can make us sick. In people who don't have asthma, the immune system usually ignores things like pollen, dust, or exercise because those things don't really cause problems. But in people with asthma, the immune system can overreact. It might react too strongly to something that's harmless. It could react to something that it shouldn't, or respond in an unusual way. This overreaction causes inflammation in the airways, which makes it even harder to breathe and leads to asthma symptoms. Not everyone with asthma has the same triggers, therefore not everyone's immune system responds the same way. So we've mentioned triggers a few times so far this evening. Triggers are things that can set off an asthma symptom. This slide shows how different the triggers can be. For some people, it might be pollen, pet dander, smoke. Other people, it could be exercise, cold air, or even strong emotions like laughing, crying, and stress. Some of these triggers, such as weather or emotional stress, can be less obvious. Given that many of you live in the Northeast, for example, changes in the season or breathing in cold winter air abruptly can really impact your asthma. Studies show that patients have, on average, 8 different triggers. The triggers can also change over time, and so they may not be the same as they used to be. That's why it's helpful to pay attention to what makes your symptoms worse and talk to your doctor if you notice new patterns and keep track of it in a notebook or an asthma journal, which we'll talk about later. Here's a simple look at what's going on inside the body when someone with asthma is exposed to one of their asthma triggers. We start with a normal airway. Then a trigger, like pollen, smoke, or a virus, comes in, interacts with the surface of the lungs. This surface is part of the front line of defense. In people with asthma, that trigger causes the immune system to react. Special immune cells are activated and they start a chain reaction. That reaction causes swelling in the airways, tightness of the muscles around them, and extra mucus production. So what's the result? Those familiar asthma symptoms, coughing, chest tightness, shortness of breath, wheezing, and in more serious cases, asthma attacks or even hospital visits. That's why it's so important to understand why the immune system is playing a key role in asthma. It helps explain why asthma happens and how certain treatments can work. So now that we've seen how asthma symptoms start with the immune system's response, let's talk about why that matters for your treatment and how your care team can use that information to better manage your asthma. When you're exposed to a trigger, certain immune cells get turned on, and that leads to inflammation in your airways, but not everyone's immune system reacts the same way. Different types of immune responses may need different kinds of treatment. That's why your doctor might order some blood tests or other checks to help figure out what's happening in your body specifically. This kind of testing can help your healthcare team choose the best way to manage your asthma and not just have a one-size-fits-all approach for asthma. Now we're moving into what I think is one of the most important parts of this program, which is managing the role that you play in your asthma care. Even though asthma can be serious and sometimes hard to control, there's a lot you can do to take charge of your health. Understanding your triggers, keeping up with your medications, tracking symptoms, and staying connected with your healthcare team are all things that you have the power to do. This next section is about helping you feel more prepared, more confident, and more in control of your asthma, day to day and long term. The first way you can take control of your asthma is by making simple changes at home and in your daily routine. These lifestyle changes can help reduce your exposure to triggers and keep you healthier overall. On the left of the screen, you'll see a few things you can do around the home, like keeping bedding clean, lowering the humidity, and limiting pet dander. And on the right are some healthy habits that support your lungs and your immune system. Things like eating well, exercising regularly, managing stress, and avoiding tobacco smoke. These may seem like small steps, but when combined, they can make a real difference in how well your asthma is controlled. We'll go into a few of these in a little bit more detail, but it's important to know that lifestyle changes, just like medications and doctor visits, are a key part of managing your asthma. One really important way you can take control of your asthma is by paying attention to your indoor environment, especially if you spend a lot of time at home or perhaps work at home. There are a number of things you can do to cut down on indoor triggers. Vacuum or sweep regularly to keep dust and allergens under control. Wash your sheets and blankets often and use allergy covers on pillows and mattresses. Try to limit pets in the bedroom, even though they're your favorite snuggle buddies. Keep the humidity below 50%, which helps prevent mold. And stay away from indoor smoke, whether it's from tobacco, wood-burning fireplaces, or even candles. Also, sealing doors and windows can keep out outdoor pollution and secondhand smoke. If possible, you might consider using an air purifier or reducing clutter or materials that collect dust. These small changes can really make a big difference in how well your asthma is controlled, especially over time. Let's talk about some healthy lifestyle choices that can make a real difference in managing asthma. There are things that many people can start doing right away, and these really add up over time. Try to practice breathing exercises. These can help you stay calm during flare-ups and improve how your lungs work. Managing stress is important too. Stress can actually trigger asthma symptoms for some people. Even some phone apps, such as Calm or other meditation apps, can really help decrease your need for rescue medications. Avoid tobacco smoke. We'll talk about that more in a minute. Keep a healthy weight, as extra weight can make it harder to breathe. And don't forget, eat heart-healthy foods, get enough sleep, and take your medication exactly as prescribed. Try to stay active with safe, regular exercise as recommended by your healthcare provider. These small, steady steps in these areas can really help you feel better and stay in control of your asthma in the long run. You've just seen how these small lifestyle changes can make a big difference in managing asthma. Things like eating well, staying active, and avoiding triggers. But how do you pull all that together in a way that's easy to follow day to day? That's where a written asthma action plan comes in. One of the best tools you can have to manage your asthma is this written asthma action plan. This is a plan you create with your healthcare provider that helps you know exactly what to do depending on how you're feeling, such as when you're feeling well, when your symptoms start to get worse, and what to do if you're having a serious flare up or an asthma attack. It covers three key areas: your medications, any lifestyle changes you need to make, and keeping track of symptoms in an asthma journal. Your asthma action plan really relies on all three of these components, and it's important to review this action plan regularly and bring it to your appointments so your doctor can update it as needed. And remember, if you're having an asthma attack, don't wait and seek medical help right away. One of the best tools to support this asthma action plan is an asthma journal. This can be as simple as jotting notes in your phone, a notebook, or using an app, whatever works best for you. There's plenty of platform choices. Tracking your asthma helps you and your doctor see patterns and spot warning signs early. It might keep track of how your breathing feels each day, when you need your rescue inhaler, if you've had any flare-ups or needed oral steroids, times when you were around a trigger, like if you visit a friend who has a cat and you started sneezing and your eyes got all itchy. Don't forget to also document if you had to miss school, work, or something important with family because of asthma. Or if you're waking up at night more than twice a month. That's one of the rules of two we talked about earlier. All of this information gives your doctor a much clearer picture of what's happening between visits and helps you work together with them to fine-tune your asthma plan. It's much easier to document these things day to day and bring that record with you than trying to recall your last 3 to 6 months. Your asthma action plan isn't just a form. It's a step-by-step guide made just for you, and it helps know exactly what to do each day to manage your asthma, what to watch for when symptoms start to change, and how to adjust your medications if things get worse. It also includes what to do when you're exercising, feeling sick, or in an emergency, and it tells you who to contact if you need help. This plan should be developed with your healthcare provider and you as a team. It should be updated regularly, so don't forget to bring it to your appointments, and having a clear plan can make a stressful situation much more manageable. It can help you stay in control even if your asthma is not in control. Now that we've talked about the importance of tracking your symptoms and working with your provider to build an action plan, let's look at another key part of your asthma management, your medications. Understand what you're taking and why you're taking it and how it fits into your plan can make a huge difference in staying on track and avoiding these flare-ups or asthma attacks. This diagram shows some of the different types of medications that might be part of your treatment plan. Not everyone will use all of these. Your plan will be based on your individual needs. But rescue inhalers, they're used when symptoms flare up and they work quickly to help you breathe easier, but they shouldn't be relied on usually as the mainstay of your care. Daily controller medications, often called long-acting inhalers, help prevent symptoms from happening in the first place. Think about it kind of like brushing your teeth to prevent cavities. You can use these medications to prevent an attack. You can even keep your daily inhalers with your toothpaste if that helps you remember it. Oral steroids may be used with short term when symptoms are really severe. They help to control inflammation after an asthma attack. It's necessary sometimes, but it's a band-aid on the problem. It means that your asthma is not well controlled and there are some side effects with these medications. Writing down each time you've had to take these can help your doctor get a better picture of your asthma and help you to treat the root cause of your asthma. This is really important because oftentimes it's not your asthma specialist who's prescribing oral steroids. They could come from the emergency room, urgent care, or a variety of other providers. Allergy medicines. It can also help your asthma if your asthma is worsened by things like pollen, dust, or pets. And for some people who have severe, hard to control asthma, biologic medications may be an option. These are newer treatments that target specific parts of the immune system that we referred to earlier. The important thing is to stick to the plan that you and your doctor create together and ask questions if you're ever unsure what your medications are used for or what part it plays in your overall asthma care. Okay, now let's take a closer look at what an asthma action plan really looks like and how it works. An asthma action plan is a written, personalized set of instructions that helps you know exactly what to do each day, what to watch for as symptoms change, and how to respond during an asthma attack. It includes things like your medications, your triggers, and steps to take when you notice your symptoms are getting worse. The goal is to help you recognize early warning signs and take action before things escalate. Most plans use the simple traffic light system, green, yellow, and red zones, to make it easier to understand and follow. Green zone, this is where you want to be most of the time. Your asthma is under control, you're breathing comfortably, and you're taking your daily controlled medication as prescribed. Yellow zone, this is the caution zone. You might be coughing more, using your rescue inhaler more often, or waking up at night with symptoms. This is your signal to slow down, follow your action plan, and possibly adjust your medications with the guidance of your provider. Red zone, this is an emergency. You've been having severe flare-ups, feeling like you can't breathe, your medications are not helping, or you have signs like blue lips or trouble speaking. This is when you should follow your emergency instructions and call 911 if needed. If you don't already have an asthma action plan, ask your doctor about creating one. Studies have shown that having a written plan helps reduce asthma attacks and keeps patients out of the ER and improves quality of life. This is true for both adults and kids. Having a clear, personalized asthma action plan isn't just helpful, it's one of the most important tools you can do to stay safe, stay in control, and breathe easier every day. Now that we've talked about how important an asthma action plan is, I want to show you what one actually looks like. Here are a few examples from trusted organizations like the Allergy and Asthma Network, the American Lung Association, and the Asthma and Allergy Foundation of America. There's QR codes here. Each of these follow the same color-coded system that we just went over, green, yellow, and red zones, and includes places to write in your medications, your triggers, emergency contacts, and more. Feel free to scan these QR codes and download any of these templates and bring it to your next doctor's appointment and fill out together. Having that written down plan can really make a huge difference in your asthma care day to day. In the next several slides, we'll look at how different environmental factors, including air quality, smoking, and vaping, can seriously impact your asthma control. So let's shift our focus to something we can't always see, but that has a big impact on our asthma: air quality. The air we breathe can be affected by a number of things, like pollution from factories or traffic, cigarette smoke, vaping aerosols, and even marijuana smoke. All these things can irritate your lungs and make asthma symptoms worse, especially if your airways are already inflamed. You might not be able to control all of your environment, but knowing what's in the air around you can help make safer choices, whether you're at home, at work, or out in the community. When you have asthma, the quality of the air outside can really affect how you feel, and on bad air days, it can make your symptoms worse. That's why it's helpful to check the Air Quality Index, or AQI, before heading out. It's a color-coded system that tells you how clean or polluted the air is. Green and yellow zones usually mean the air is okay for most people, but once it hits orange or red, those with asthma or kids or older adults or anyone with lung issues should try to stay indoors or limit activity outside. You can check the air quality online at airnow.gov, on the weather app on your cell phone, or even on local news. Planning your activities for times when the air is cleaner can help you breathe easier and avoid flare-ups. Let's talk about one of the biggest asthma triggers out there: cigarette smoke. Cigarette smoke contains over 7,000 chemicals, including many that are toxic and at least 70 that can cause cancer. Even just being around cigarette smoke can be harmful. About 1 in 5 people with asthma still smoke, and many others are exposed to it through friends, family, or the environment. For people with asthma, smoking is a common and powerful trigger. It can cause more frequent asthma attacks, increase the risk of lung infections, and even make your medications less effective. In fact, cigarette smoke is the second most common cause of asthma attacks reported by patients. If you or someone close to you smokes, talk with your healthcare provider about ways to cut back or quit, because every step towards cleaner air can help your lungs feel better. We've talked about cigarette smoke being a major asthma trigger, but let's look a little bit closer at how it affects the body, especially if you have asthma. Smoking can lead to poor asthma control overall, which means more unexpected doctor visits and more frequent symptoms. It can also reduce how well your asthma medicines work, making it harder to stay stable. Inside the lungs, smoking can cause increased mucus, damage the tiny hairs called cilia that help clear the airways, and raise the risk of lung cancer. All of this adds up to a lower quality of life. More symptoms, more limitations, more worry. If you smoke or live with someone who does, know that even small steps towards quitting or reducing the exposure can start to make a big difference. So we've talked about how smoking affects people with asthma, but it's not just the person who's smoking who's at risk. Secondhand smoke comes from the tip of cigarettes. It can also come from the smoke they're just breathing out. For someone with asthma, especially children, it can cause wheezing, coughing, asthma attacks, and even lead to hospital stays. But there's also something called third-hand smoke. That's the toxic residue that's left behind on things such as furniture, carpets, clothing, and even walls. These chemicals can build up over time, and it gets into your body through your skin, mouths, and lungs. Even if the air looks clean, these harmful stuff can still be around, and that's why avoiding exposure in shared spaces is so important. Vaping might seem like a safer option than smoking, but for people with asthma, it can be just as harmful. The smoke from e-cigarettes, or what's called aerosol, contains nicotine, chemicals that can cause cancer, and flavorings that are all linked to lung disease. Vaping can make asthma worse by causing flare-ups and shortness of breath, increasing coughing and wheezing, and reducing your lungs' ability to fight off infections. Even if you don't vape yourself, being around others who do can still affect your breathing. This is especially concerning for kids and teens who may be drawn to sweet flavors, but may not realize that vaping can trigger serious asthma attacks. If you or someone in your home is using e-cigarettes, talk to your doctor about how to reduce the risks and protect your lungs. Something that often gets left out of the conversation is marijuana smoke, but it's important to know that this can also be harmful for people with asthma. Like cigarette smoke, marijuana smoke contains toxins and chemicals that can irritate your lungs. It can lead to more coughing, wheezing, and mucus. It may also interfere with other medications you're taking for asthma. Even if it's used for medical reasons, smoking or vaping marijuana is not recommended for people with asthma. Marijuana comes in many forms, so if you have questions or are considering using it, the best thing you can do is talk to your healthcare provider. They can help you find the safest option for your health. To wrap up this section, let's look at some simple lifestyle changes you can make to help reduce the impact of poor air quality on your asthma. First, check the outdoor air quality before you go outside, especially on days where you plan to exercise or spend a lot of time outside. If you smoke or vape, talk to your healthcare provider about ways to cut back or quit. And if you live with someone who does, try to reduce your exposure. Secondhand and third-hand smoke can linger on clothes, furniture, and in the air, so keeping your space smoke-free really matters. Don't forget that even vape aerosol contains harmful chemicals and can trigger asthma symptoms. Every one of these steps helps protect your lungs and gives you more control over your asthma, one choice at a time. So just wanted to offer up this resource. So if you do smoke or vape or know someone who does, and you're thinking about stopping, just know this, it's never too late to quit. Stopping can help improve your asthma control, reduce your symptoms, protect your lungs. If you're ready to take that first step, just scan the QR code for some resources to help you quit, or ask and talk to your healthcare provider for specific support. As we close out this important section, I just want to emphasize that you play an important role in your asthma care and that it's a good thing because it means that you have some control. There are 3 simple but powerful things you can do. First, understand your level of control. Know the signs that your asthma is well managed and also know when something might be off. Think about the rules of 2. Second, track your symptoms and triggers, whether it's through a journal, an app, or a note on your phone. Writing things down can help you and your doctor spot patterns and adjust your treatment plan as necessary. And finally, speak up. Be your own advocate. Ask questions, bring your action plan to appointments, and take an active role in your health. As a pharmacist myself, I definitely want to encourage everyone, if you ever have questions about your medications, stop by your local pharmacy, ask your pharmacist. When you do those things, you're not just reacting to asthma, you're managing it. And that can make all the difference in how you feel every single day. So let's take a moment to wrap up what we've covered so far. First, you've learned that asthma is a long-term condition that causes inflammation in the airways, and that some people have more severe or hard to control asthma. Secondly, you understand now that asthma isn't just about the lungs. It can also involve the immune system. Your triggers and symptoms may change over time, and knowing how your immune system responds to these can guide your treatment. And most importantly, you'll manage because there are things you can do every single day to help control your asthma. That includes tracking symptoms, avoiding triggers, sticking to your treatment plan, and working closely with your healthcare team. You really can have the power of your asthma. The more you understand it, the more you can take charge of your care. So on the screen are a few different resources. We have American Lung Association, the Allergy and Asthma Network, as well as LUMA. So this program was brought to you by LUMA, and you can access many resources, including handouts, asthma journals, videos, and things of that nature. It's luma-edu.com. Again, that's luma-edu.com. You can also scan the QR code at the bottom of the slides. Here are some additional resources. I'll pause just for a second. And a few more resources. As you can see from the past few slides, there's a plethora of information that is safe for you guys to rely on to better understand and better control your asthma. You'll have access to this via recording, and so I want to encourage everyone to come back and explore some of these links. But most importantly, write down and remember your questions and take them with you with your next appointment with your asthma specialist. And thank you all so much for joining today's webinar. I really appreciate you taking the time to learn more about asthma and how you can take an active role in managing it. Before we go, I'd love for you to take just a minute to scan the QR code on the screen and complete a short survey. Your feedback helps us make these sessions even more helpful in the future. And now I'll pause and open it up to questions if anyone's put them in the chat. Jan would be more than welcome to open them up.
Yes, so we are going to get to the questions in 1 minute. I just wanted to say to you, Brenda, I'm going to cover a couple of things and then we'll get to the questions. I wanted to thank you for this incredible program tonight, sharing such important information about asthma. the health condition of asthma and management strategies. And I think for everybody here, my guess is you may have known some of this information, but I would imagine not all. Understanding, key takeaways, the role of the immune system, so important. Um, Rules of two. If you hadn't heard that before, you heard it tonight and you understand what that means and how it can help you in your management. So thank you, Brandon, for that. I also think it's important when you talked about lifestyle changes. Small adjustments can really make a big change in your health. So that's important to understand. And understanding medicines, the difference between the controller medicines that Brandon talked about, long acting, and then the rescue medicines, the short acting medicines, and the role they play. And the asthma action plan and the journal are key management strategies. So many important pieces of information here tonight. And I want to thank you sincerely, Brandon, for that. And I want to thank Amgen again for your sponsorship of this program tonight. Thank you so much. And if we can possibly take the screen down now for the LUMA program and stop our recording, that would be terrific. Thank you so much, Brandon. Really, really superb.